A very good evening to one and all. Welcome back to the today's session. Today our guest speaker is Dr. ALPESH JAYSWAL sir. So we welcome you, sir. We welcome you all the participants. So over to you, Aditi. Yeah.
Hello. Hello everyone. It's me, Dr. Aditi Ghanesham Malkani, PG scholar from Srimati Kebbi Abad Homeopathic Medical College, Nasik, Chanwad. Initially, I would like to thank Dr. Lavanya Sai, BHMS MD, PhD scholar, National Secretary of AIHSAYA. Secondly, I would like to thank Team AIHSAYA Webinar Organizing Secretary, Dr. Arpana Sandeep Parikh ma'am, Professor and HOD Department of Preparatory, Srimati Kebbi Abad Homeopathic Medical College, Chanwad, Nasik, for organizing such a fabulous webinar at the initiation of the week. Good evening. Addressing today here to a respected person who is going to conduct a fabulous webinar on the topic balancing female hormone naturally, homeopathy with nutrition and lifestyle. I would like to welcome our guest speaker, Dr. ALPESH JAYSWAL. Introduction in short, he is Associate Professor, Department of Organ of Medicine, PARUL Institute of Homeopathy and Research from Gujarat. Knowing more about our today's speaker in short, Dr. Jayswal sir is PhD scholar at Shri Govind Guru University, Godhra. He has completed his MD Homeopath from Jawaharlal Nehru Homeopathic Medical College and Hospital, Parul University. He has completed his BHMS from Shri Shyamalji Homeopathic Medical College and Research Institute affiliated with HNGU, Patan. I would like Dr. Jayswal to continue the webinar and share fruitful and informative knowledge on the interesting topic. Over to you, sir, please.
Thank you.
Over to you, sir. We welcome you, sir.
Thank you. Good evening, everyone. Myself, Dr. ALPESH JAYSWAL. I am from the Vadodara. It's both an honor and privilege to join you all today at this insightful platform organized by the All India Homeopathic Students and Youth Association. I extend my heartfelt gratitude to the organizers for giving this opportunity. Especially thank you, Dr. Arpana Parikh ma'am, who is the organizing secretary of this platform, and Dr. Lavanya ma'am, who is the general secretary of this association, All India Homeopathic Students and Youth Association. And today we are going to discuss our topic, the balancing female hormones naturally, homeopathy, nutrition, and lifestyle. Is very important topic in today's world, where hormonal imbalancing among women, especially in young girls, are on the rise due to stress, diet, and lifestyle changes. As a homeopath, I strongly believe that the healing must be gentle, as we know, gentle, the ideal cure, individualized, and harmony with the body's natural rhythm. Okay. So in homeopathy, when we combine this mindful nutrition, that is balance lifestyle, this our homeopathic remedies, this whole lead to the holistic approach to restoring that normal health without disturbing the natural phenomena of the body, without doing any side effect. In this session, I will be sharing insights on how homeopathic remedies, supportive dietary habits, and lifestyle modification can help regulate the endocrine system, improve menstrual health, and enhance overall well-being in women. So let's start with sharing my today's presentation. So as the title is very simple, the today's topic is very simple, but when we try to understand with the uh, another angle of our mind, the topic is very important in our routine life and routine practice also for the homeopathic students and homeopathic veterinary also. Balancing female hormones naturally. homeopathy, nutrition, lifestyle. So here first we understood, just a second. First we understood nature. Okay, when we heard the word nature, okay, nature, okay, nature means balance. If there is balance, that is nature. So everything in nature is about the balance. Same thing happen in our body also. As a homeopathic student, homeopathic faculty, in homeopathy we already know the balancing of the vital force, that in between the health and the sick, that balancing of the vital force, that energy, when in the equilibrium state, when it is balanced state, we are healthy, we are doing our work in the best manner. That is healthy state. So where is balance, there is health, there is everything in nature is balance. So balancing is very important in the nature. Okay. So when we talk about the hormones, okay, imbalancing of the hormones, and we try to balancing hormones through the natural way, there is three major points are there. From the homeopathy, the first homeopathy already help to the balancing hormones naturally, and the other two major parts are there, the nutrition and lifestyle. As a medical student, medical fraternity, it's very basic thing. Already we know about this 2 points: nutrition, what are the nutrition, what are the balance, what is the balanced diet regarding this type of problems, and lifestyle. Already we know about it. But in homeopathy also we have so many remedies, so many medicines, and so many uh, therapies are there. Okay, with the help of homeopathy medicines, we can try to balancing, we can resolve so many endocrine problems also. So as a teacher, I advise to all the students, whenever you do the practice homeopathy, uh, it is very important to understand the homeopathy principles, remedies, remedica organ. It's okay, it's a main part, it's a core part of our system. Okay, and we keep case taking, then we may make the totalities, we individualize the patient, we match the remedy on the basis of totality of the symptoms. It is a whole process. But whenever we treat the patient, when we treat the patient as a whole, okay, two more things are very important, that is a nutritional advice and nutrition. You also have proper knowledge regarding the nutrition and the lifestyle advices. So it's both are very important points. So balancing hormones naturally, the homeopathy aligns with the body's innate healing mechanism, working in harmony with its natural rhythm rather than overriding them with the external hormones. As we know, our homeopathy works with the innate healing mechanism. Homeopathic remedies stimulate the body's self-regulatory process. This individualized approach helps the body adapt naturally, reducing symptoms without disrupting its hormonal feedback system. The hormonal feedback system, the endocrine system, it's very important system of our body. It's maintaining so many important function of our body, growth, development, and so many important function of the different functions of the organs, which controlled by the endocrine system. So that our homeopathy medicines are have capacity without disturbing that feedback system, that hormonal feedback system, which already present by nature. Our medicine just only to give support to resolve that imbalancing with the help with the help of our remedies in the dynamic form. It's a very holistic approach. This holistic method ensure that the treatment works with the body's natural cycle, promoting sustained health and equilibrium. So our medicine help to balancing that hormonal imbalance which done in the body due to some cause. As we know, the importance of hormonal balance in a woman. There are hormone regulate a wide range of body functions: menstrual cycle, metabolism, sleep, mood, and reproductive health. When in balance, they promote physical, mental, and emotionally well-being. So, what is health? Health is all, according to WHO, also defined as the when there is equilibrium, balance between the physical, mental, and emotionally. That's well-being. That is health. So, one hormone is very important for responsible to maintain such type of the system, such type of balancing in our body to maintain health. And here I just explained some issue due to imbalancing of hormone, but that imbalancing can lead to PMS, PCOS, the premenstrual syndrome, polycystic ovarian syndrome, irregular periods, mood changes, acne, fatigue, that fluctuate hormones, estrogen, cortisol, thyroid hormone. These problems are increasingly common among women due to lifestyle stressors, dietary habits, and environmental factors. Here, so many problems which are occur due to the imbalancing of the hormone. But today we are more focused one condition, that is premenstrual syndrome. I just explain PMS here because it's a very common and very neglectable problem in nowadays in school going, college going girls, and that complain PMS. Let's we just insight on this topic, on this hormonal imbalance, that is PMS, premenstrual syndrome. Okay, so we know the due to the hormonal imbalancing, there are variety of symptoms are that mood swings, low libido, headaches, night sweats, food cravings, weight gain, etc., acne, insomnia. These are the symptoms which are usually occur in the females due to this imbalancing of the hormones. uh, uh, so today we are going to focus on the PMS and its impact on women's health. So premenstrual syndrome is a very basic, a very easy topic. But when we try to understand, to find out how many its prevalence rate in among women, among girls, it's very important for us to treat such type of condition in regular manner, in acute level. So many so many efficiency of the women's which have results. So premenstrual syndrome is collection of physical, emotional, behavior that symptoms occurring before menstruation. It affects a significant percentage of women, impacting daily life mood, productivity, and overall well-being. Common symptoms include mood swing, bloating, headache, fatigue, and irritability. It's very simple to understand, to diagnose the PMS. So, what is PMS? What is definition of the PMS? PMS is a collection of the physical, emotional, and behavioral symptoms that occur in the luteal phase of the menstrual cycle, typically 7 to 10 days before menstruation, resolve with the onset of menstruation. So here is the main thing: the collection of physical, emotional, behavioral symptoms of that occur in the luteal phase of the menstrual cycle, that is 7 to 10 days before that menses, and resolve with the onset of menstruation. Symptoms can range from mild to severe and affect daily activities. It is the main thing, its impact on the daily activities of that woman, that girl. So it lead to the disturbing their daily routine also, and lead to disturbing uh, their mental level also. So the homeopathy, with the help of homeopathic medicines, with the whole homeopathic management, we can treat and we can resolve that issue also. What are the common symptoms, emotional, physical, and behavioral symptoms of the PMS? There is emotional symptoms: mood swings, irritability, anxiety, depression, sensitivity, crying spells are there. Physical symptoms: bloating, breast tenderness, headache, fatigue, joint, muscle pain are there. Behavioral symptoms: food craving, sleep disturbance, difficulty concentrating, with withdrawal from social interaction. So here are the very basic symptoms. When you understand that symptoms, it's affect the daily routine of the that girl, that life, that student. So it's hamper the work, it's hamper the study, it's hamper the daily routine, it's hamper the emotional emotional balancing. It's hamper the social gathering, social behavior. So it's very important, uh, and it's very ignored in our society also. It's a very common, it's okay, uh, it's very common in our society. So we cannot treat her. और गर्ल्स को भी ऐसा रहता है कि इसकी ट्रीटमेंट की क्या जरूरत है, कोई नहीं, बट आप डीपर जब समझोगे कि इस प्रॉब्लम्स एक नहीं बहुत सारी गर्ल्स में अपनी रूटीन मेंस्ट्रुअल साइकिल में रहता है, इस प्रॉब्लम की वजह से वो अपने डेली रूटीन्स में बहुत सारा चीजें हैम्पर करती है और उससे भी कुछ ज्यादा प्रॉब्लम सीवियर भी होते हैं. तो विद द हेल्प ऑफ होम्योपैथी वी कैन हेल्प prevalence. So in this prevalence rate, you understand how it is very uh, important topic. PMS is highly common in reproductive age women, with the study indicate that 50 to 80% of women experience some PMS symptoms. The severity of symptoms varies. Some women may have premenstrual dysphoric disorder, EMDD. That is a more severe form of the PMS. Some women also have this type of complaint also. Young women, particularly those in their late teens and early 20s, may be more affected due to hormonal fluctuation and lifestyle factors, the straight diet and sleep pattern. So prevalence to 50 to 80% of women experience some PMS symptoms. The prevalence rate more high, but still very ignorable this problem in our society. Causes, as we know, very basic causes, the hormonal imbalances, role of estrogen, progesterone fluctuation is there. That is the impact of stress, diet, and lifestyle also, and how neurotransmitters like serotonin are affected. These three levels, 3 points are a cause for this hormonal imbalancing in PMS. First, just let explain role of estrogen and progesterone fluctuation. During the menstrual cycle, estrogen and progesterone rise and fall, and imbalance between this hormone contributes to the PMS symptoms. It's very basic thing. Whenever the estrogen progesterone up and down and imbalancing, that lead to the PMS symptoms. Different PMS symptoms are there. Estrogen dominance that can cause mood swings, irritability, and breast tenderness, and low progesterone can lead to anxiety, depression, poor sleep. This fluctuation affects neurotransmitters like serotonin, influencing mood and emotional well-being. So, very basic hormone, estrogen, progesterone, that imbalancing lead to the such type of symptoms, mood swing, irritability, and breast tenderness. So, ये सारे जो हार्मोन्स है वो डायरेक्टली इम्बैलेंस नहीं हो जाते. एज वी नो इन होम्योपैथी there is some cause, okay, that cause are different, okay, that cause are some fundamental causes also, that's exciting conditions, exciting causes also there that lead to one anxiety, कोई भी डर, कोई भी cause that lead to imbalancing the hormones, that lead to those physical symptoms that reflect on the mental level and social level, that diseases go further. Impact of stress, diet, and lifestyle. If we have stress in our life, so many problems are there. In present data, it's very common, okay, to find out the anxiety disorder, depressions, okay, stress. बहुत सारे स्टूडेंट्स के अंदर भी पढ़ाई का स्ट्रेस, बहुत सारी चीजों का स्ट्रेस रहता है. दैट स्ट्रेस लीड टू सो मेनी प्रॉब्लम्स, इंसोम्निया and panic attacks are there. Okay, so it's very common nowadays. If we focus on the students and their behavior with their अगर वो change होता है अपने normal behavior से, we just inquiry that it's very common. क्योंकि stress की वजह से बहुत सारे students आजकल के stress जल्दी ले लेते हैं, okay? चीजों को बहुत ज्यादा दिमाग पे लेना, उसको tolerate नहीं कर पाना, okay, that will lead to so many problems in their life. With the homeopathy, I think it's very important for us. With the help of homeopathy, we can overcome with the help to the students also. Stress. Chronic stress increase cortisol, which can disrupt progesterone levels and worse PMS symptoms. Okay. Stress lead to this cortisol, okay, chronic stress that lead to the cortisol hormone effect. Diet high in processed food. Okay, as we know, we all just uh, go through this Take the processed food, okay, sugar, caffeine, and alcohol can worsen hormonal imbalancing, leading to bloating, fatigue, and more disturbances. Present era that is very common. We are also taking directly, indirectly such type of foods also. So a long time, such type of foods always sometimes lead to the different problems also. Lifestyle, sedentary habits, lack of exercise, and poor sleep quality negatively affect hormonal regulation and PMS severity. As we know, after Corona, there is a sedentary due to sedentary lifestyle, lack of exercise, work from home, and such type of exercise, such type of habits, which lead to the obesity, which lead to the different physical problems to the body. The third point, the third cause of the PMS, the how neurotransmitter like serotonin are affected. Serotonin, the feel-good neurotransmitter, is influenced by estrogen level. Low serotonin levels can lead to mood swing, irritability, and food cravings. Homeopathy helps regulate neurotransmitter naturally by addressing the hormonal and emotional aspect of the PMS. So these are the causes of which affect, which lead to the imbalancing of the hormones and lead to the PMS, premenstrual syndrome. So, as homeopath, we are talking about the homeopathic holistic approach. Homeopathic approach. Uh, First, premenstrual syndrome. Okay, we have a lot of medicines. We have a lot of remedies to treat this type of condition. Okay, premenstrual syndrome बहुत easy, बहुत common complaint है. Okay, nowadays. बोलने में पढ़ने में बहुत कॉमन है. You just find out, go and ask one survey to your college, to surround you, to note down the complaint of that girl. Okay, what you have, what you feel, okay, in your just luteal phase of the period. Okay, what are the complaints, just note down, and grading that complaint, you find out the severity of that problem in our society. Okay? So first we try to understand homeopathic holistic approach. Homeopathy, our principles of homeopathy, which a natural principle, that is we focus on individualization and minimum dose, and we try to address the root cause, not just symptoms. Okay, we focus on the root cause of the disease. Okay, not just symptoms, because symptoms is just outwardly picture. Okay, not the proper disease. Proper disease is inside. Okay, root cause, okay, that lead to the effect to the body, that lead to the symptoms. So we just address on the root cause of the disease, and we restore hormone balance naturally, and we try to restore that hormones balancing naturally. The principle of homeopathy, we know individualization and homeopathy, minimum dose. Individualization, homeopathy does not follow one size fits all approach. Instead of remedies selected based on patient's unique symptoms, temperament, and overall constitution. Okay, we focus on the that individualization. And second point is the second very important principle is the minimum dose. Homeopathic remedies work on the principle of using highly diluted substance to stimulate the body's self-healing mechanism. This minimize side effect and ensure gentle yet effective treatment. Okay, we believe in ideal cure with the help of highly diluted our medicine are there. Okay, dynamic medicines which help the body's self healing mechanism to help to vital force restore its normal state. Okay, so we believe in a quality minimum dose. हमारी medicines बहुत highly diluted रहती है. Okay, so it minimize that side effect and help to restore very rapidly. As per second aphorism, high standing cure. As we know, may I already talk about we are focusing in the root cause. Conventional treatment for PMS, it present era हम treatment क्या करते PMS में? Symptom suppression. Okay, hormonal tablet, painkiller, hormonal therapy is there. Or homeopathy, however, works to identify and treat the underlying hormonal balancing, emotional trigger, and systemic weakness contributing to PMS. By correcting this root cause, homeopathy provide a long-term relief rather than temporary symptom control. Okay, तो कोई भी अगर कोई भी गर्ल लेडी पीएमएस की कंप्लेन लेके आती है, हम फोकस कर दे कि उनको इस कंप्लेन एक्स वाई जेड 1 2 3 कंप्लेंट्स हो रही है, वो क्यों हो रही है. ओके, कंप्लेंट्स बहुत नॉर्मल है, common, but still we find out that unique, unique cause of that particular lady, particular girl, कि इनको ये चीज क्यों हो रही है, क्या फील हो रहा है, उनसे क्या डिस्टरबेंस हो रहा है, वो उससे उनके काम में क्या दिक्कत आ रही है, ओके, कितनी हद तक सीवियरिटी क्या है, ओके. तो विद द हेल्प ऑफ होम्योपैथी वी कैन treat that symptoms, we can treat that person. Homeopathy remedies stimulate the body's own regulatory process rather than artificially altering hormonal level. Remedies like pulsatilla, sepia, lachesis helps rebalance estrogen, progesterone, improving both physical and emotional symptoms. Since homeopathy works with the body's natural rhythm, its strength overall health without disrupting the endocrine system. Okay, so it's uh, very important to understand that homeopathy not just solve your problem and solve your symptoms, solve your disease. Okay, correct. But it always strengthen your immunity, strengthen your vital force for future प्रॉब्लम्स. ओके, तो हमारी जो हेडेड टेंडेंसी है, हमारी बॉडी के अंदर जो ऑलरेडी प्रॉब्लम्स है, उसको जस्ट क्योर के सारी चीज को ओवरकम नहीं करता, बट फ्यूचर के लिए हम और पावरफुल हमारे स्ट्रेंथ, वाइटल एनर्जी को और पावरफुल स्ट्रेंथ प्रोवाइड करता है. तो please mute. Okay. So now just we go on different homeopathic remedies for PMS. So many medicines are there. Here I just discuss few remedies are there. Before we discuss one survey. Okay, so first we understood a few remedies, very important remedies for the PMS. The sepia, pulsatilla, lachesis, calcarea car, natromure, ignitia, nux vomica, macphos, bryonia, onium mac. Okay, just the key homeopathic remedies, key points are there. Sepia, it's best suited for women with marked irritability, indifference to loved ones, and a dragging sensation of the pelvis. Symptoms are often relieved by exercise. So very basic symptoms which should for the that woman who feel this such type of symptoms, PMS symptom. Pulsatilla, changeable moods are there, fearfulness, mild depression. The patient craves consolation and openness, lackadaisicence, intense irritability, talkativeness, intolerance to tight clothing, symptoms worse before menses, improve once bleeding starts. Calcarea for women who experience anxiety, excessive fatigue, and breast tenderness before periods. They often have a tendency toward weight gain and chilliness. So every remedies are specific corrected symptoms are there. When you go through the whole remedy and understand the core of the remedy, then you understand that these symptoms of the PMS symptoms are should for that particular patient, that first patient. Okay. Natriureticum, helpful for women with suppressed emotions are there, headaches and water retention before menses. They often crave salty food and prefer solitude. Ignitia, best for PMS with emotional hypersensitivity, mood swings, and sigh. Helpful for those who suppress grief and disappointment. Nux vomica, suit for women with marked irritability, constipation, and oversensitivity to stimuli. Symptoms may be aggravated by stimulants like coffee and alcohol. MACPOS, indicated for spasmodic dysmenorrhea with cramping pain, relieved by warmth and pressure. Okay, MACPOS is very basic remedy and very commonly used in the clinic also. Okay, in a biochemic as a biochemic remedy also. Okay, so for the student, it's very important to understand. To MACPOS, it's very frequently used in spasmodic dysmenorrhea, spasmodic pain. Okay, so many problems having this such type of pain. So you think about MACPOS also. Bryonia useful when there is a breast tenderness and irritability with a preference for being left alone and avoiding movement. Conium mac is recommended for painful and swollen breast, that is astudina before menstruation, along with the sense of pregnancy. These are the few remedies. So many remedies are in the homeopathy. All are best. First, one principle is that to match the totality of the symptoms. Okay, when there's similar remedies there, and when you find out the simillimum, perfect simillimum, then it is that medicine for that particular condition. Here is the one assessment I want to show here, because it try to understand you see how PMS is major problem in our surrounding. Okay, so the screening of PMS in college girls. In my college, I just screening for my study. I just first screening the all the college girls. Okay, for PMS. A small scale screening for PMS was conducted among female students at our college to assess the prevalence and severity of the symptoms. Okay, मैं समझना चाहता था कि PMS की अगर स्टडी करनी है, पीएमएस कितना एक्चुअली में इतना प्रिविलेंस है, सीवियर क्या है प्रॉब्लम से, तो उसको डेप्थ को समझने के लिए कि हाउ इट अकर, okay, कितने how many girls are affected their routine life and such. So just the screening to aim to identify the student experiencing significant PMS related discomfort, evaluate the potential case for further study. Okay, before study हम जब थोड़ा पायलट स्टडी थोड़ा स्क्रीनिंग करते हैं, उस स्क्रीनिंग के यहाँ पे डेटा है. ओके, तो आप भी अपने कॉलेज में आपके एरिया में कर सकते हो स्क्रीनिंग और फाइंड आउट कर सकते हो कि ये कितना बड़ा मेजर इश्यू है. उस हिसाब से आप होम्योपैथी मेडिसिन ट्रीटमेंट स्टार्ट करो या कैंप करो, ऐसा आपको कुछ आइडिया ले जा सकता है. पार्टिसिपेंट वे एसेस यूजिंग अ स्ट्रक्चर्ड क्वेश्चनरी covering common PMS symptom including mood changes, bloating, headache, fatigue and menstrual irritability. यहाँ पे एक ऑलरेडी क्वेश्चनरी प्रेजेंट है, वो क्वेश्चनरी से डायरेक्ट हमने यस नो ग्रीडिंग लाइक सिम्टम्स पूछा है. ओके, this screening serves an initial step toward understanding the impact of PMS in young women and exploring individualized homeopathic interventions. Okay, तो एक स्टेप है इनिशियल, तो अगर इम्पैक्ट समझना है पीएमएस का इम्पैक्ट कितना है, ओके, यंग वुमन पे, और आगे कुछ अगर स्टडी आपको करना है उससे पहले इम्पैक्ट समझो कि पीएमएस का इम्पैक्ट आपके आसपास अभी कितना है. ओके, उस हिसाब से हम फर्दर स्टडी भी कर सकते हैं. The findings will contribute the future research on effective homeopathic management of PMS, focusing on holistic, patient and specific treatment approach. Okay, so these are the screening data. ये 100 पेशेंट में टोटल स्क्रीनिंग किया गया. ओके, 100 पेशेंट तो नहीं, 100 गर्ल्स में स्क्रीनिंग किया गया. एज थी 18 to 25 ईयर्स, उसका डेटा यहाँ पे. उसमें 42 गर्ल्स ने अमंग 100, ओके, 42 गर्ल्स प्रीमेंस्ट्रुअल सिंड्रोम इंटरफेयर विद योर डेली एक्टिविटी. उन्होंने हाँ बोला कि वो उनकी डेली एक्टिविटीज में ये पीएमएस की कंप्लेंट उनको इंटरफेयर करती है. ओके, 42 गर्ल्स ने यस बोला. 46 okay, patients are rated between the 5 to 10 on a scale of 1 to 10 in severity of PMS symptom. Okay, so scale the 1 to 10 the severity of symptoms में 5 to 10 में टिक किया 46% girls ने. Okay, so around 50%. Okay, 46%. Okay, 46%. 85% patient with more than 2 complaints of PMS. Okay, 85 among out of 100, 85 girls are having more than 2 complaints of premenstrual syndromes are there. Okay, you see, complaint is not single. Okay, more than 2. 30 patient with irregular menstrual cycle is a very important data. Out of 100, 30 girls. Okay, it's present era, present situations are there. Okay, I just take the 100 girls, you just read a survey in whole college. Okay, then you understand how it affect that complaint. Okay, among out of 130 girls that having irregular menstrual cycle, you know, irregular menstrual cycle lead to so many problems, so many further complications, so many further problems. Okay, 70% girls patient with regular menstrual cycle. Okay, out of 100, 30 are irregular menstrual cycle, 70 are regular menstrual cycle. 60 willing to participate in randomized study for homeopathy treatment for PMS. So 60 girls उसमें पूछा गया कि फर्दर कोई स्टडी होती है PMS के लिए, तो आप इंटरेस्टेड हो गए. 60% out of 100, 60 girls ने हाँ बोला. This is the data, and data is very important to understand. When you understand the 46% that girls, okay, that pain is 5 to 10. Okay, they rate the pain scale is 5 to 10 on a scale of 1 to 10 severity of symptoms. Okay, and 42% girls are complaining that symptoms which interfere with interfere in their daily activities. Okay, 85 30% girls having more than 2 components. Major main point is 30% girls having irregular menstrual cycle. So this irregular menstrual cycle due to some causes, anything, okay, that cause are just to find out with the help of case taking. This is a questionnaire already available on online source also, premenstrual syndrome scale, PMS. There is a scores are there, just you take the scores and find out the severity of the uh, case. Okay, here I just here put some screenshot of the different research work in this easy topic. When we talk about easy, it's not easy. When you read in Google Scholar and online sources, so many research works with the in homeopathy are there. I just put here some screenshots, some glimpses of that work also. Okay, so PMS, it's very very basic and very helpful topic for nowadays for students, okay, for us to research in that area. Okay, it's because हमारे आसपास बहुत सारे गर्ल्स, बहुत सारे फीमेल्स को ये प्रॉब्लम है, तो हम विद द हेल्प ऑफ होम्योपैथी रिसर्च उनको हेल्प भी कर सकते हैं और हम होम्योपैथी रिसर्च में कुछ एड ऑन भी कर सकते हैं. Here is the one study, the placebo controlled double blind randomized trial with individualized homeopathic treatment using a symptom cluster approach in women with PMS. Okay, एक स्टडी है placebo control effects on homeopathic treatment women with PMS syndrome, a pilot study. And the study is this semi individualized homeopathy add-on versus usual care on only PMS cases. यहाँ पे दो है, एक homeopathic medicine, एक में usual care. Okay, ये सारी स्टडीज के एंड एक चीज मैं बताना चाहता हूँ कि विद द हेल्प ऑफ होम्योपैथिक मेडिसिन, ओके, अगर हम ये जैसे 100 गर्ल्स में हमने सर्वे किया, ओके, दिस आउट ऑफ 100 गर्ल्स सम हैविंग irregular menstrual cycles, regular menstrual cycle, okay, so when we do the treatment, okay, when we give the treatment, okay, person to person, girl to girl, okay, वी अंडरस्टैंड दैट कॉज. ओके, हमको लिस्ट डाउन करना है कि इस पेशेंट में क्या मेन कॉज था, कितने महीने में ट्रीट हुआ, सेकंड पेशेंट. ओके, तो सारे सिम्टम्स का कुछ ना कुछ कॉमन सिम्टम्स फाइंडिंग, तो हम एक मेडिसिन बॉक्स भी बना सकते हैं पीएमएस का. ओके, 50-100 गर्ल्स को ट्रीट करो, ओके, आपके आसपास जितने क्या कॉमन रेमेडीज मिलेगी. ओके, कॉमन रेमेडीज मिलके बॉक्स बना, जैसे फर्स्ट एड बॉक्स रहता है. ओके, जैसा पीएमएस किट बना सकते हैं, इसमें कुछ प्राइमरी बेसिक रेमेडी होम्योपैथी की हो, वो बना के हम कॉलेज में, स्कूल में रख सकते हैं इंडिकेशन के साथ. वेरी बेसिक मेडिसिन, ओके, कोई भी हम उस इंडिकेशन को पढ़ के ले सकता है एज अ प्राइमरी टूल. ओके, प्राइमरी लेवल पे ये चीज भी कर सकते हैं. तो कभी भी, क्योंकि बहुत कॉमन चीज है, किसी को भी कभी भी पेन हो सकता है, ये सारी चीजें, तो ऐसी 5-6 रेमेडी, 10 रेमेडी, ओके, आप कुछ 100 गर्ल्स को स्टडी करके उसमें ऐसा कुछ भी कर सकते हैं, या कॉमन रेमेडी होम्योपैथी की रख सकते हो उस फर्स्ट एड बॉक्स जैसा. ओके, पीएमएस किट बना सकते हैं, तो हेल्प कर सकता है. ओके, बहुत सारी रूटीन प्रॉब्लम को फटाफट ओवरकम, या घर के लिए हाउस होल्ड किट के लिए एज अ बेसिक लेवल. ओके, अगर डॉक्टर अवेलेबल नहीं है, बता नहीं सकते, अगर आप कहीं बाहर गए, तो बेसिक लेवल इसमें से आप इस सारी फेमस प्रॉब्लम्स के लिए मेडिसिन ले सकते हो, इस इंडेक्स अगर है तो. ओके, वेरी बेसिक लेवल, एडवांस लेवल पे तो नहीं कर सकते, बेसिक लेवल पे चीज कर सकते हो. तो ये एक आइडिया है, बहुत सारी स्टडीज इस पे भी हुई है. ओके, कुछ कॉमन रेमेडीज फाइंड आउट करने के लिए फॉर पीएमएस पायलट स्टडी भी हुई है. Apart from the homeopathic point of view, homeopathic remedies always help to balancing its hormones in a natural form. Okay, but the two parts, as I've already talked in lecture. Okay, in starting of lecture, lifestyle and dietary advice, it's very important. Okay, first, as a doctor, we have proper knowledge of the diet and lifestyle advice. Okay, how the advice given to the patient. Okay, अकॉर्डिंग टू द पेशेंट. ओके, पेशेंट को भी देखना पड़ता है कि कौन सा पेशेंट है, किस हिसाब से उनको एडवाइस दी जाए. ओके, तो होम्योपैथी का नॉलेज तो है, बट अपार्ट फ्रॉम, हनुमान सर ने बोला, आपके पास पूरा पेशेंट को एज अ होल ट्रीट करने के लिए जस्ट मेडिसिन से ट्रीट नहीं करना. ओके, कभी कभी मेडिसिन की भी रिक्वायरमेंट नहीं होती, जस्ट पेशेंट को काउंसिल करके भी हम ट्रीट कर सकते हैं. ओके, तो ये जो एरिया है, इसमें हमको डाइट का नॉलेज, कि हम बैलेंस डाइट. ओके, पेशेंट को कंप्लेन क्या है, पेशेंट किस सोशल बैकग्राउंड से आ रहा है, सोशल इकोनॉमिक बैकग्राउंड से आ रहा है, उस हिसाब से just give the advice, we give the dietary advice, we give the lifestyle advice. Okay, उस हिसाब से एडवाइस, उसका नॉलेज भी होना जरूरी. ओके, हम होम्योपैथी फोकस करते हैं, मेडिसिन पता है, सब कुछ पता है, बट बेसिक चीजें हमको पता होने जरूरी है. पेशेंट बहुत पुअर बैकग्राउंड से है तो उसको उस टाइप से डाइट एडवाइस जो उसके लिए इजी हो जाए, देखिए उसके हेल्थ के लिए वो इजीली एसेस कर पाए, इजीली वो ले पाए, ऐसी चीज को हम एडवाइस दे सकते हैं. ऐसा लाइफस्टाइल के लिए कुछ भी एडवाइस दे सकते हो कि जो इजी हो. Okay? The importance of this balanced diet and lifestyle is very important to balancing this hormonal imbalance. Importance of balanced diet: whole foods. Eating a diet rich in fresh fruits, veggies, lean protein, and whole grains helps regulate hormones naturally. Reduce sugar intake. Sugar is a very important thing. Okay, here we must reduce the sugar. Not only just this problem also, but in all our health. Okay, high sugar consumption can lead to the blood sugar spikes, increasing mood swings and fatigue. Healthy fats, omega-3 fatty acids, okay, supports hormone production and reduce inflammation, easing PMS symptoms. Exercise and stress management, okay, it's today's era, it's very important. Yoga, meditation, regular exercise, it's very important thing for all the conditions. This practice help lower cortisol level, which can otherwise disrupt progesterone balance and worse PMS symptoms. Regular physical activity like exercise like walking, swimming, or strength training help release endorphins, reducing irritability, anxiety, and fatigue. Okay, it's very basic thing. Okay, very basic thing. All we know, but it's very important to implement in us and our patient also. So how it possible? Okay, that thing is very important. Okay, बहुत सारी चीजें इंटरनेट पे, वीडियोस पे, इंस्टाग्राम पे, यूट्यूब पे अवेलेबल है. ओके, ये चीज करने से ये चीज होता है, ये डाइट ट्रेडर्स वो, बट प्रैक्टिकल लेवल के हमारे आसपास, हमारी फैमिली में हमारे पे कौन सी चीज इजी एप्लीकेबल हो सकते हैं. इट्स वेरी इंपॉर्टेंट हाउ वी ट्राई टू एप्लीकेबल इन वेरी इजीएस्ट फॉर्म. ओके, हम मेजर अगर कोई भी पेशेंट, इनिशियल एक पेशेंट था मेरे पास, वो थोड़ा इनिशियल ट्रीटमेंट लेने कुछ कंप्लेंट्स के लिए आया था. ओके, वजन था, थोड़ा सेडेंटरी लाइफस्टाइल था. ओके, मैंने कुछ एक्सरसाइज योगा बोला, एक्सरसाइज योगा करो, ये एक्सरसाइज करो, वो एक्सरसाइज करो. ओके सर, इसका ये प्रॉब्लम है, उसका एक्सक्यूजेस है कि योगा ये पता नहीं है कैसे करूँ, टाइम नहीं है. ओके, आई जस्ट सजेस्ट वॉक करो. ओके, आप काम हो जाए उसके बाद 10 मिनट वॉक करो, बैठ जाओ, 10 मिनट वॉक करो, बस एक ही. ओके, तो एक सब कॉमन एडवाइस. ओके, उसके माइंड में उसके पास एक्सक्यूज नहीं होना चाहिए. पेशेंट के पास तो बहुत एक्सक्यूज रहते हैं. योगा करने के लिए सुबह इतने बजे उठना पड़ता है, मेडिटेशन करने के लिए ध्यान ध्यान नहीं, मेडिटेशन नहीं होता. ओके, ये एक्सरसाइज नहीं होता, जिम नहीं ज्वाइन होता. ओके, कहीं नहीं, 10 मिनट 15 मिनट वॉकिंग करो, जब भी टाइम मिले दिन में 2 बार करो. ओके, एक काम दे दिया उसको 15 मिनट का, तो 15 मिनट एटलीस्ट वॉक करना स्टार्ट किया, इट्स गुड थिंग. ओके, फिर आगे धीरे धीरे बढ़ेगा. तो ऐसा छोटा सा मोटिवेशन, स्मॉल मोटिवेशन, वेरी इंपॉर्टेंट to initiate that process. Okay, with the help of medicines. Okay, medicines तो देनी चाहिए. होम्योपैथी मेडिसिन इज वेरी बेसिक थिंग. ओके, वी आर होम्योपैथ. ओके, हमको ट्रीटमेंट तो देनी है, होम्योपैथिक ट्रीटमेंट. उसके साथ साथ जहाँ जरूरी है वहाँ लाइफस्टाइल एंड डाइटरी रिकमेंडेशन बहुत मस्ट. ये चीज वहाँ कहीं ना कहीं लैक्यूना है हमारे नॉलेज में, हमारे डे टू डे प्रैक्टिस में. ओके, जिस पेशेंट को हम एग्जामिन, जिस पेशेंट को एज अ होल केस टेकिंग करने बैठते कि व्हाट इज योर नेम, ऑक्यूपेशन, ओके, एंड प्रेजेंटिंग कंप्लेंट, पास्ट कंप्लेंट. ओके, it's very important. Okay, that homeopathic case taking, okay, we try to understand the patient, we individualize the patient, it's very important. But another part, the examination of patient, okay, it's also very important. Okay, we should examine the patient, we should examine the respiratory system, nervous system, okay, locomotor system. Okay, which is applicable according to the case. It's very important thing also. Okay, to to impact on the patient. Okay, पेशेंट को पूरी तरह समझने के लिए, ओके, वो पेशेंट में भी इंप्रेशन आए कि डॉक्टर ने मुझे एग्जामिन किया, उसको भी तसल्ली लियो मेंटल लेवल पे. ओके, दैट थिंग इज आल्सो इम्पोर्टेंट. ओके, एंड थर्ड पॉइंट, द बैलेंस इन दिस लाइफस्टाइल एडवाइस, कि आपको ये चीज करनी है, ये चीज नहीं करनी. ओके, तो स्मॉल स्मॉल एडवाइस आल्सो वेरी इंपॉर्टेंट टू द patient. Adequate sleep and hydration. Sleep regulation. Poor sleep affects the hypothalamus pituitary adrenal axis, which controls hormonal balance. At least 7-9 hours of quality sleep is essentially. At present era, it's very difficult to take this 7 to 9 hours of quality of sleep. Okay, hours is not very good. Quality of sleep is very important, very essential in our this day-to-day life. Hydration, drinking enough water prevents bloating, supports detoxification, keeps hormone regulating organs functioning optimally. Okay, so benefits of the homeopathy for PMS: it is safe and non-toxic, no side effects of hormone or hormonal suppression. Okay, हम hormonal suppression नहीं करते, it's very important thing. Okay, and personalized treatment for long-term relief. Okay, we believe in the individualized approach improves overall being, not just PMS symptoms. Okay, our homeopathy is a highly diluted natural substance, making it safe for all individuals, including young women. It does not introduce synthetic hormones or chemicals into the body, reducing the risk of adverse reaction. Okay, हम homeopathy medicines डायरेक्ट diluted medicines हमको हार्मोन इंजेक्ट नहीं करते. Okay, no side effects or hormonal suppression. There is no any suppression. Unlike conventional treatments such as birth control pills or painkillers, homeopathy does not interfere with the body's natural hormonal rhythm. It works gently to correct imbalances without dependency or withdrawal effects. Personalized treatment for long-term relief. Homeopathy treatment each woman as an individualized, addressing her unique PMS symptoms, mental state, and constitution. This ensure last improves overall well-being, not just PMS symptoms. We focus the personalized, individualized treatment, improves overall well-being, not just PMS symptoms. We focus as a remedies strengthen the immune system, emotional stability, and hormonal health, leading to better energy level, improved digestion, enhance mental clarity, promote better quality of life. With the help of our medicine, we promote better quality of life by addressing the root cause of the PMS rather than symptoms management. Okay, these are the problems. The PMS, we just focus on the premenstrual syndrome, how it very common in our society. It's very important to treat or cure with the help of homeopathic medicines, and there is a scope of in homeopathy. Some research works are also there in this field. Okay, so the conclusion of this whole lecture is 3 points are there. First, we believe we understand homeopathy is an effective and natural choice for PMS relief. Not only PMS relief, other hormonal imbalancing also. Homeopathy provides safe, individualized, and long-term solution for PMS symptoms. Okay. Second, need for awareness and more clinical research. It's our responsibility as a student, as a fraternity, as a faculty. Okay, हमारे हमको पता है तो हमको अवेयरनेस करना है. ओके, स्कूल में जाके कॉलेज में जाके अवेयरनेस की कंप्लेंट से तो आप उसको नोटिस करो, उसकी ट्रीटमेंट है, ट्रीटमेंट देनी चाहिए. ओके, ये सारी चीजें प्रेजेंट एयर में होना चाहिए. क्लिनिकल रिसर्च, ओके, हम उसमें रिसर्च कर सकते हैं. Increasing public awareness, scientific validation through clinical study can help establish homeopathy as a reliable option. Third one, encouraging women to seek holistic health solution. Okay, encourage करना है women को. Women should be empowered to explore natural and holistic approach rather than just solely relying on conventional medicines. Women को भी पता होना चाहिए होम्योपैथी में भी options है, conventional medicine पे ही only rely ना करें. These are the conclusion of this lecture. I hope it's my try to insight that premenstrual syndrome is a very common but very important problem in present era. We try to overcome with the help of homeopathy medicine and to restore that woman's health. It's in a hormonal imbalancing that we can restore. Okay, thank you so much all of you for listening. Okay, if you have any query, doubt, you can mail me, you can put the message on this my numbers and email ID. Thank you so much.
Dear participants, if you have any questions, you can comment in the chat box so that we will get answers from the sir. Thank you, sir. Thank you so much for the wonderful session. Now, moving on to the question and answer session. Respected participant, you can ask the questions now in the chat box. Sir, what are the common investigations we can go for this, sir, to check regarding this nutritional deficiency, hormonal deficiencies?
In nutritional hormonal deficiency, first we try to understand the patient कि patient को क्या क्या problems है. Okay, problems के हिसाब से जैसे कभी कभी कुछ गर्ल्स को HB बहुत एनीमिक यानी एनीमिक रहती है. Okay, अगर उनको बहुत वीकनेस कमजोरी बार बार आपको कंप्लेंट कर रही है हर मंथ पे कि मैडम मुझे कमजोरी है, ब्लीडिंग बहुत ज्यादा हो रही है, तो यू चेक द नॉर्मल CBC एंड ऑल द थिंग्स है ना. आफ्टर द CBC अगर HB बहुत कम है, एनीमिक है, तो उस हिसाब से आगे रिपोर्ट्स फर्दर करने चाहिए. कभी कभी विटामिन की डेफिशिएंसी, ये सारी चीजें भी आजकल प्रेजेंट एरा में है बहुत सारी गर्ल्स के अंदर. विटामिन D है, विटामिन B12 है, तो सारी विटामिन की भी कमी रहती है. तो उस हिसाब से बस वेरी बेसिक रिपोर्ट इज अगर कोई फीमेल को गर्ल्स को अगर बहुत वीकनेस बहुत बहुत कमजोरी हो, बहुत ज्यादा प्रॉब्लम्स हो, CBC start. Very basic report of CBC. You should first observe the HP and then further reports which indicate that.
Sure, sir. Thank you so much, sir.
I want to share one thing. At present, it's our duty, okay, to इट्स वेरी कॉमन प्रॉब्लम. ओके, हम आसपास जो भी गर्ल्स है, जो भी कॉलेज गर्ल्स है, ओके, आप एज अ टीचर, ओके, एज अ फीमेल टीचर, एज अ स्टूडेंट टू फाइंड आउट, ओके, एक सर्वे करो, ओके, कितने लोगों को प्रॉब्लम्स हो रहा है. फीमेल फीमेल सबको होता है, ओके, पर किसी को नॉर्मल निग्लेजिबल, पर जिसका अगर डेली एक्टिविटी, जो मेरा डेटा था उसके डेली एक्टिविटी इंटरफेयर हुआ था, उसको फाइंड आउट करो, ट्राई करो हील करने. ये एक्सरसाइज हर एक कॉलेज में हम कर सकते हैं. ओके, इस एक्सरसाइज से स्टूडेंट्स को भी नॉलेज मिलेगा कि कैसे केस टेकिंग करना है, वो सारे चीजों का. और फोर्थ ईयर इंटर्न्स को भी पता चलेगा कौन कौन सी होम्योपैथिक फीमेल रेमेडीज फीमेल्स को ट्रीट करने के लिए है, और एक्चुअली मेंस्ट्रुअल इरेगुलरिटी या ऐसे प्रॉब्लम्स को भी हम ट्रीट कर सकते हैं. तो ये एक एक्सरसाइज हर एक कॉलेज में हर एक लेवल पे करना चाहिए स्टूडेंट्स के बीच में. बेसिक भी और इजिली हो भी सकती है. ओके, स्टूडेंट्स को दो. ओके, आप पूछो कंप्लेंट्स, ट्रीटमेंट कैसे, कौन सी मेडिसिन आपको लग रही है. ओके, अंडर द सुपरविजन ऑफ टीचर वी कैन डू दैट.
Yes, sir. We can take it over there, sir. Yes, sir. Sir, I hope the participants are clear with the topic, sir. So, upon that, shall we conclude the session, sir? Yes, sir.
Yes, ma'am, you can.
Yes, sir. Thank you, sir. We would like to thank Dr. Alpesh, sir, for the extensive session, and we would like to thank all the participants for their active participation. Thank you, sir. Looking forward for many more sessions. Thank you, all the participants. Stay back, and we will be soon with the other sessions by tomorrow. Thank you, sir. Thank you, participants. Yes, sir.
Thank you, ma'am. Thank you. Bye.